Welcome to Knowledge at Mchart video tutorial. Mchart EMR is a fully certified, complete EHR and practice management solution for the ambulatory environment. Mchart is easy to use, reliable, intuitive, and makes your life as a healthcare professional easier. In this session, we'll be going over how to prescribe electronically with Mchart ePrescribing. With Mchart ePrescribing, physician practices are able to improve efficiency, save time and money, and avoid paying any penalties. In order to e-prescribe, eligible providers must be enrolled with an eRx service to prescribe electronically. If not, they'll be charged a penalty by CMS. The penalty is, for the 2013 calendar year, a payment adjustment of 1.5% of reimbursements received for Medicare Part B services. So to avoid the penalty, first things first, make sure you're enrolled with an e-prescribing service to prescribe electronically. If you are not sure if you're enrolled, please contact Mchart customer support or your account manager for assistance. Depending on your role at your clinic, you'll be given different levels of authorization in the e-prescribing menu. Physicians, nurse practitioners, or physician assistants can create, sign, and send prescriptions electronically. Additionally, they are able to approve prescription renewals. Clinical staff, which includes nurses and medical assistants, can create prescriptions for providers to sign and approve, but they are not permitted to sign the prescription or approve renewals on their own. However, they are able to add or edit patients' medications and allergy information. In this video, we will show you how to e-prescribe as a provider. We'll start like we always do by logging in. And when you log in, on the left side of the dashboard, there are refill requests and RX pending notifications. These links will take you to the e-prescription window where you can submit approval requests to renew a prescription, as well as submit requests to sign off on prescriptions which you, the provider, or authorized clinical staff have prepared. Now let's go over how to prescribe electronically from a progress note or a chart. Select a patient. Let's click here on patient Michael Doe. Open his chart, and you see that in his chart are the following information your staff has already entered: the patient's current medications and the patient's allergy information. Here's a chart that the provider's already filled out. The only part of the chart that we need to fill out to complete it is the RX portion at the way bottom of the chart. So we go to the RX prescription at the bottom, click RX, and click Write Prescription. So now we go to the eRx screen. Here you're able to select the pharmacies where the patient can most conveniently pick up their medication. Once you select a pharmacy for the patient, it will be added to a patient's pharmacy favorites list. This favorites list allows you to conveniently have on file for the patient their pharmacy information so that every time you prescribe a medication for them, you can have this information at your fingertips. Multiple pharmacies can be added to the favorites list depending on the patient's preferences. Next, let's go over how to do a keyword search for medications you want to prescribe. You can search for a drug by typing the name of the drug in the search field. Let's try to search for the drug Tums. You'll see the name of the drug appear as a selection, and when you see the drug name, you simply select the correct medication among the search results. Now at this point, Mchart's eRx drug verification and Drug-Allergy verification alert system notifies you immediately if there are any interactions between the patient's current medications and allergies and the new medication you wish to prescribe. This is a very helpful feature as it will ensure that you prescribe with more safety and precision. You may also enter other pertinent prescription details here, such as SIG, duration, quantity, and number of refills. When you're done, click Continue, then preview the prescription information you have entered. The medication you wish to prescribe can be added to your favorites if you think this medication will be prescribed often, not only for this specific patient but also for other patients in your clinic. You add to favorites by clicking here on the Add to Favorites button. Saving drug information in the favorites menu saves you a significant amount of time. So now click OK, and by doing so, the prescription becomes a pending prescription. You can modify prescription details or delete the drug if necessary. There's now just one more step remaining before we're done prescribing. The final step is to enter your signature password, which is equivalent to your wet signature. Be sure to keep your signature password safely and securely. After you have entered your signature password, you send the prescription to the selected pharmacy. Note that if you print the prescription without sending, it is not considered an e-prescription because you did not send the prescription directly to a pharmacy. When you've entered your signature password, you've completed the e-prescribing process. Before closing the e-prescription window, let's go over briefly how easy e-prescribing can be using a favorites list and a current medication list. Let's go back to the first screen of the Rx window. Select a pharmacy from the favorites list. If you want to send prescriptions to a new pharmacy, click on Pharmacy. Here, let's select one pharmacy from the favorites list and also a drug from the favorites list too. Click on the Use button first, and unless you need to modify the details of the drug, such as SIG, duration, or quantity, you can continue with your signature password, and there you have it, you're done prescribing. You want to make sure all transaction messages appear in blue text directly above the prescribe a medication field after you do something in the eRx portion. Now let's close the eRx window, and when you close the window, your updated medication information will be automatically added to the chart. If you have any questions about the e-prescription feature, please call for help, and a customer support team member will help you out. Thank you for watching this Knowledge Mchart video. We hope this tutorial was very easy and straightforward. For more information, please check out our website at www.mchartemr.com or email or call our customer support team, info@mchartemr.com, 949-756-1408.